I will be presenting a case that underscores the importance of considering uncommon causes of vitamin B12 deficiency, particularly in patients presenting with unexplained neurological symptoms. The case involves a 34-year-old male with a history of diverticulosis who developed subacute combined degeneration of the spinal cord, a rare but serious complication of B12 deficiency. Our patient presented with a 3-week history of progressive weakness and gait instability. He reported no recent illnesses, fever, rash, or any GI symptoms. His neurological examination revealed bilateral loss of proprioception and vibratory sensation in the lower extremities, and ataxic gait and dysmetria. Despite reporting a well-balanced diet, his clinical presentation strongly suggested underlying vitamin B12 deficiency. Laboratory tests confirmed the suspicion, showing a low B12 level of 117. In addition, his methylmalonic acid as well as homocysteine levels were significantly elevated. Further tests to identify common causes of B12 deficiency, such as pernicious anemia and celiac screen, were negative. The patient was also found to have normal levels of copper. An MRI of the spine revealed high intensity within the dorsal columns, a finding consistent with the inverted V sign, characteristic of subacute combined degeneration. It was during this diagnostic process that the patient disclosed a history of chronic nitrous oxide inhalation for recreational purposes, commonly referred to as whippets. This revelation was key in identifying the cause of his B12 deficiency. Nitrous oxide has become increasingly popular as a recreational drug due to its euphoric effects, easy accessibility, and affordability. Notably, nitrous oxide is not regulated by the DEA, contributing to its widespread use. In fact, the 2018 Global Drug Survey ranked nitrous oxide as the 7th most popular drug worldwide, excluding alcohol, nicotine, and caffeine. The mechanism by nitrous oxide leads to vitamin B12 deficiency is particularly concerning. Nitrous oxide irreversibly oxidizes the active cobalt ion within vitamin B12, rendering the vitamin inactive. Then this inactivation disrupts the function of methionine synthase, an enzyme crucial for the conversion of homocysteine to methionine. Methionine is essential for myelinating phospholipids and maintaining neuronal integrity. Additionally, there is a hypothesis that nitrous oxide affects myelinotoxic and myelinotrophic cytokines, potentially leading to myelin loss and neuronal dysfunction. In cases of chronic nitrous oxide abuse, standard B12 tests might show low or even low normal levels because they measure both the active as well as the inactive forms of the vitamin. Therefore, a more sensitive approach to evaluate vitamin B12 deficiency involves measuring levels of methylmalonic acid and homocysteine, which are elevated when B12 is either deficient or inactive. However, these biomarkers are not exclusive to vitamin B12 metabolism and require careful interpretation. In conclusion, this case illustrates the potentially severe neurological consequences of chronic nitrous oxide abuse due to its impact on vitamin B12 metabolism. It emphasizes the need for clinicians to remain vigilant for uncommon causes of B12 deficiency, particularly in patients presenting with unexplained neurological symptoms. By doing so, we can better prevent and manage the risk of irreversible neurological sequelae in the affected individuals.